Hey guys, so this is not post-op day 14. I'm actually exactly post-op 3 weeks today. I was just looking through my videos that I've taken, and I did say in post-op day 13 that I would take a video day 14 as well, and I did take a very short one on that day, but I can't seem to relocate it or see where it's gone, so I don't know whether it's been deleted or whether it's got lost. So I thought I'll do a video today instead. I probably have a lot more to update you all on today than I would have on post-op day 14. I think from what I remember, I did say on post-op day 14 video that I was a little bit worried about my I think I mentioned about my smile and really too much swelling in my nose at the start, and I did ring and request if I could speak to the main nurse who was looking after me throughout the entire thing, and she actually called me back and was absolutely lovely. She reassured me so much. She'd made me feel so positive, and she made me feel like it's actually very natural to feel the way that I felt. And once you do have your surgery, as soon as the cast comes off, at first, like I did, I loved it, but then when you go home you realise that sometimes you can't really recognise yourself, and it's really difficult to smile or laugh or move the nose, and because of the swelling it just looks, you know, not what you may have expected. But it's all about patience, and that's one thing that I've learned throughout this process. I am only post-op 3 weeks, and I've already got my smile completely back. So there we are, that's my smile, and it's completely back. No problems at all with trying to smile. Not any pain really, just a little bit when I'm if I'm like blowing my nose or something. I mean, you can't blow your nose that much. I actually just phoned the main nurse again today because I've had a bit of a cold, so I was just wondering whether I can take medication, because I've only been taking paracetamol and it's not really been helping too much, and my cold has just come back again, so I don't know whether it was safe for me to take medication. And she gave me all the advice. She said it's fine, you know, if you've got a cold after the op it should be okay just to take normal meds. So I'm just on paracetamol and like a bit of night nurse and day nurse, and then I've just booked into my my post-op 6-week appointment in December, so I will do a video on that once I have gone there. In terms of my mood, I think at this when I was like up until 2 weeks, I was a bit like upset because no one was really understanding that I went through, you know, a massive operation. I've got a lot of swelling. I'm still very, you know, fresh out of surgery, and it's not going to look fantastic within, you know, 10 days post-op really, and it just takes time. And for me right now, I have seen a massive change in my nose. I feel like it's gone even more straighter. I feel like the tip has gone so much more skinnier, and also when I started at work, people who've been off for a couple of days and then come back, they've actually commented on it and said, actually I can see a massive change in your nose over the last 4 days. You can see that there's like completely less swelling. So I'll show you now from the side. So that's that side, which I'm very happy with. I think this is my favourite side. I don't know, maybe it's just a girl thing, I don't know, but I like this side. It's very straight, still a little bit numb, but not that much as it was before around the tip of the nose. With the scarring, I don't know whether you can see properly, but I hardly have any. So there we are. And this side, which is nice and straight, exactly how I wanted it. And yeah, I love the front profile, I love the side profiles, and I just think to myself every day, I am so glad that I chose Dr. De Silva to do my op, and it's the best decision I've ever made. I mean, it's still quite hard because you can't really exercise so much, and still quite swollen on the tip, but to me, I feel confident. And even if I have this nose for the rest of my life, I would be over the moon, because it makes me feel so much more confident. I'm driving around now and I don't really care what people think. Sometimes I forget that I've had it done and I think, oh, I don't like my side profile. I can't really show it. And then it clicked, then I realised actually no, I've got the nose that I wanted now. There's nothing to worry about. So it's the best feeling in the world, really. I don't think there's anything else that to say, really. Just yeah, just feeling fine. I've been at work for a week as well now, so I mean, people have noticed. I didn't say anything to anyone, but they've said that there's something changed on your face, but they just didn't know what it actually was. So I did say I had an op, and they said, you know, it looks wonderful, and they said that your nose looks so much better than before, and it just suits your face completely, and it looks so natural, which is what I'm happy about, really. I've also seen a few of my other friends and family, and they've actually not even noticed that I've had anything done, so that's brilliant, and it makes me feel a lot more confident, and I just needed that. I also went out in the public properly. I think it was about 3 days ago, so went out for a meal and, you know, got together with everyone, and it just felt nice again, you know, because you've been in the home and the house for so long, and it just felt nice to be out and be yourself and feel yourself again. With regards to my sleeping, I'm still sleeping quite with my head elevated, because I think it's helped with the swelling so much, and the way that Dr. De Silva said that I needed to tape my nose, I think that has helped so much as well. That's how I could see that when I do tape it, and if I've missed a little bit of tape here, I can see all of this is quite thin, and then this part will be a little bit swollen, so the taping really does help, and really keeps the nose in its shape, really. So I'm going to continue doing that for the next 6 weeks or so, and you just do that when you're out of the public eye. So when I'm sleeping or I'm at home, I do that. And yeah, I think that's all for now, just to give you a bit of an update. It's better than, I thought 3 weeks post-op is probably a better video than, you know, having day 14, and there wasn't much to update on that day anyway, just had to say a few little things. So yeah, I'll do my next video on well, December the 7th, maybe on that day, because I've got my post-op appointment. I think that's when they give, well, Dr. De Silva will offer me some more injections, I think, as he mentioned. I'm not sure whether I will take them, because I don't think I personally would need them, because my swelling has decreased so much over the last, it's not taken very long, to be honest, for the swelling to decrease. It's gradually becoming less and less. So I'll give you all an update by the video on the 7th of December. And that's all for now. Thanks. Bye.